Good evening, and welcome to my podcast called Robotic, Surgical Instrumentation, and Patient Safety. My name is Camelia Smith. My instructor is Jacqueline Hankey, and this is my surgical instrumentation podcast for class. We're going to start with the introduction and thesis. I will be discussing robotic surgical instrumentation and its impact on patient safety in the operating room. Robotic assisted surgery has expanded rapidly in modern healthcare environments. These systems allow surgeons to perform complex procedures using minimal invasive techniques. While robotic technology improves visualization and precision, it also introduces challenges related to instrument handling, maintenance, and staff training. Robotic instrumentation differs from traditional surgical instruments. These devices contain multiple moving parts, electrical components, and delicate joints. Because of this complexity, robotic instruments require specialized knowledge. Improper preparation can lead to delays, equipment malfunction, and increased risk to patients. The purpose of this podcast is to explain how robotic instrumentation creates safety concerns in the operating room. I will also discuss solutions including staff education, standardized inspections, and well-improved communication. These strategies can improve efficiency and reduce complications during robotic procedures. The background on robotic instrumentations. Robotic surgery relies on advancement instrumentation designed to mimic human wrist movement. These instruments can attach to robotic arms and are controlled by the surgeon at a console, such as like a game system. The enhanced range of motion allows for precise dissection, suturing, and tissue manipulation. This precision contributes to reduced blood loss and smaller incisions as well. Despite these benefits, robotic instruments require careful handling. Many instruments include insulation layers that prevent electrical injuries. If insulation becomes damaged, energy may transfer to unintended tissues. This creates a safety hazard. Instruments can also contain cables and joints that wear over time. Robotic instruments must also be cleaned and sterilized according to the manufacturer's instructions. Complex may trap debris if not cleaned thoroughly. Residual soil increases infection risk. Staff must understand cleaning requirements to maintain instrument integrity. Another important factor is limited instrument lifespan. Many robotic instruments are approved for a specific number of uses. After reaching the limit, the instrument must be replaced. Failure to monitor usage can lead to instrument failure during surgery. Anything can happen, such as infections, bacteria, and so forth on, and many other complications during surgery. One of the main issues associated with robotic instrumentation is the improper handling. These instruments are meant to be cared for. They're expensive and very delicate. Rough handling of an instrument during transport or cleaning can cause damage to the components. And the damage may not be visible during routine inspection, but using damaged instruments can increase risk of malfunction. The incorrect assembly is another concern. Robotic instruments must connect properly to the robotic system. If not, they are not aligned correctly, the system may not generate correctly and could cause an error. This can delay the procedure and extend anesthesia times. And it also can delay increased patient risk. Limited staff training also contributes to safety concerns. Robotic systems continue to evolve. Staff may not receive consistent education, but without training, team members may not recognize damage or improper setup. This increases potential for error also. Communication gaps between departments may also affect the workflow. The sterile processing department prepares instruments. The operating team assembles them. If information is not shared, damaged or missing instruments may reach the operating room, and this can hold off the procedure for a while. Solutions with evidence. Standardized training is one solution. Education should include instrument identification, inspection techniques, and proper handling as well. Competency-based training ensures staff understands robotic instrumentation requirements. Training improves confidence and reduces errors. Routine inspection is another important strategy. Instruments should be inspected using magnification. Staff should check installation, joints, and alignments. Functional testing confirms movement and connection. Removing damaged instruments prevents intraoperative complications. Tracking systems also improve safety. These systems monitor instrument usage. Staff can identify when instruments reaches its usage limit. And tracking prevents overusage and ensures timely replacement. This quality improvement effort. A clear communication between departments is essential. The sterile processing department should document inspection findings. The operating team should verify instrument function before surgery. Team collaboration improves workflow and reduces delays. Facilities should also develop standardized protocols. Written guidelines promote consistency. Protocols outline cleaning, inspection, and assembly procedures. Filing guidelines ensure robotic instruments are prepared safely. We have some key takeaways. Robotic surgical instrumentation improves precision and supports minimal invasive surgeries. However, these instruments require specialized knowledge. Improper handling, limited training, and a lack of tracking increases risk. Education plays a critical role in safety as well. Staff should receive consistent training. Inspection protocols help identify damage early. Tracking systems prevent overuse. Communication strengthens teamwork. Healthcare teams should prioritize standardized procedures. Following evidence-based practices improves efficiency. These strategies reduce complications and protect patients during robotic procedures. My references are the Association of Preoperative Registered Nurses, Guidelines for Robotic Assisted Surgery, retrieved from AORN.org. Center for Disease Control Prevention, Disinfection, and Sterilization from the CDC. And the World Health Organization, Safe Surgery Saves Lives, from the WHO International Publications. Thank you for listening to the discussion on robotic surgical instrumentation and patient safety. Continued education and teamwork are essential for safe robotic surgeries.